Doctors, what's the biggest case of effort you've ever seen? Story 1. During trauma call in my surgery residency, we had a prisoner come in after a fight who claimed he couldn't move or feel his legs. All the CT scans and MRIs were normal, but we would shield his legs so he couldn't see them and poke them with needles and other sharp objects, with enough force to cause pain. He never flinched or moved his legs at all. He was diagnosed with PSI-WARA, spinal cord injury without radiographic abnormality. He stayed in the hospital for a week with no improvement. There was always one guard assigned to him. One night, they were down in the lobby watching television, but the guard needed to use the restroom. The patient said, "Where could I possibly go? I'm paralyzed." The guard left him alone for just 2 minutes. The patient was last seen sprinting down the road, completely unclothed, running with surprising speed. He made it to a city 4 hours away by car before being caught again. I have never seen anyone fake something so convincingly, truly playing the long con. Story 2. I'm not a doctor, but I worked in healthcare for nearly 20 years. While taking a break from the ICU, which was emotionally draining, I worked in home health for a while. I had a patient who clearly had Munchausen syndrome. Every day she would call her insurance to check what would be covered if she were diagnosed with various conditions. She called her doctor's office an average of 5 times during my shift with her, reporting all sorts of fabricated symptoms. She pushed the doctors into performing exploratory laparoscopic surgery. Of course, nothing was found. One day I walked in and found her rubbing her incisions with spoiled cabbage, trying to get them infected. She wasn't really seeking pain medication, except to sell. She was just as content with antibiotics or even stool softeners. Anything, as long as she received a prescription and got to visit the pharmacy, where she performed the same dramatic routine, claiming allergies and reactions. She constantly escalated her stories. One time she fluttered her eyes after making sure I was watching and claimed she lost consciousness in that brief moment. She then called her doctor saying she had passed out for 5 minutes, called the insurance and said it was 10, called the pharmacy claiming it was 30, and finally called 911 saying she had woken up on the floor after being unconscious for 4 hours. The most heartbreaking part was that she was a mother. Her son was 28 at the time, and from all her stories about his childhood illnesses and her claims that he was severely disabled, I realized she had most likely subjected him to Munchausen by proxy. She portrayed him as unable to ever find a partner because of his supposed condition. I met him. He was healthy and of average intelligence. He wasn't even interested in dating women. He was gay, but she refused to accept it. Working with her was so emotionally exhausting that I took a couple of years off from healthcare afterward. Story 3. I'm a pediatric neuropsychologist. I once received a referral for a patient who needed comprehensive care coordination. He was 13, used a wheelchair, required therapeutic oxygen, had seizures, arthritis, musculoskeletal issues, suspected autism, was completely nonverbal, had severe behavioral challenges, and the list went on. He was being seen by at least 8 different specialists, none of whom were communicating with each other. His medication list was about 18 prescriptions long, including extremely strong drugs like opioids, antipsychotics, and antiepileptics. He was sent to me after yet another ER visit when a doctor there suspected something was off and wanted someone to assess the full situation. It turned out to be a case of factitious disorder imposed on another, also known as Munchausen by proxy. All of the symptoms had been reported solely by the mother, going back to when he was around a year old. It may have started with a febrile seizure in infancy, but that was never witnessed by anyone except her, so it remained uncertain. She had been giving conflicting information to different doctors. She was convinced he had all these illnesses and even told him he could die at any moment. He had received a Make-A-Wish trip and various donations. Eventually, he was removed from her custody and taken off most of his medications. Within weeks, he was out of the wheelchair, playing basketball, breathing on his own, very talkative and friendly, and no longer showed any behavioral issues. He did have a significant intellectual disability, but it's unclear whether it was inherent or the result of the intense medication regimen he had endured. Hopefully, with supportive therapy and a stable environment, he'll continue to improve. Story 4. This patient came in for back pain with weakness in the legs. He received a full workup including MRI, standard blood work, and even some immunological tests to rule out conditions like myasthenia gravis. There was no neurological or immunological explanation for the weakness. Physical therapy evaluated him and concluded that he was intentionally holding back. At the end of the day, I went to see the patient and prepare him for discharge. He became furious about being discharged. He started yelling, saying he wasn't better, expressed disappointment in the institution, and continued complaining. One particular thing he said still stands out 3 to 4 years later. "I can't believe you're sending me home already. I haven't even told my family I'm here, and now you're going to send me home before they even have the chance to see me." My attending and I stepped out to make arrangements with the nurses. When we returned, the patient was out of bed, standing in the middle of the room. Miraculously, he was able to walk without any assistance after struggling with mobility over the past 2 days. At that point, he was angry that we entered the room without knocking. He was discharged after a discussion regarding inappropriate use of medical services. Story 5. I'm not a doctor, but I'm a UK-based midwife. I had a patient who had been in and out of the hospital throughout her pregnancy with episodes of heavy bleeding. This was her 6th baby, so she was a fairly well-known patient in our unit. The issue was that no one had ever actually seen her bleeding. She would call and say she had bled into the toilet but had already flushed it. All of our examinations came back normal with little to no evidence of bleeding. Sometimes during a speculum exam, we'd find only the smallest trace of blood. I was caring for her during a shift when she once again called to say she was bleeding. I walked into her room and found her using a sharp object to injure herself in order to bleed. She had been doing this throughout her pregnancy. The reason she gave: she said she had 5 noisy children at home and needed rest, and knew we wouldn't admit her unless she had a serious issue. She would do this anytime discharge was discussed. We had to complete a perinatal mental health referral and consult with the safeguarding midwives as she was putting herself and her baby at serious risk. Story 6. I'm not a doctor, I'm a nurse. We had a man who came in every 3 months to get a medical certificate stating he couldn't work at his retail job due to severe, disabling back pain. He was receiving a large insurance payout for this condition. After the doctor completed the usual exam and signed the paperwork, the man asked the doctor to check his shoulder. The doctor asked how he injured it, and the man replied that it happened while playing rugby for a competitive team. "Really?" the doctor asked. "How long have you been playing for them?" The man admitted he had been actively playing and training the entire time. The doctor included this information on the insurance form. Then he came into the staff room laughing uncontrollably. The following week, the patient came to reception extremely upset because his insurance had been canceled. Story 7. I'm a nurse, not a doctor. I once had a patient who worked in a hospital as a janitor, so he knew enough to fake symptoms. He was seeking pain medication, especially morphine, and complained of chest pain. He underwent a full cardiac workup, and everything came back normal. When he was about to be discharged, he then claimed gastrointestinal discomfort. Cleared again, fake chest pain again, cleared again. Eventually, he became my patient. I was a new face. He now claimed to have abdominal pain. I called the doctor, already aware of his history. The doctor said he'd be up soon. This patient asked for a ginger ale for his stomach. I decided to go to lunch. A co-worker walked into the lunchroom, clearly disgusted. This patient had defecated in a basin, poured ginger ale over it, and tried to convince her he had experienced fecal vomiting. He insisted he needed to laud it immediately. When I entered the room, sure enough, there was a pile of feces in a puddle of ginger ale. I told him we'd have to remove all food and drinks and insert a nasogastric tube. He instantly changed his story and admitted he was faking. I still wonder why some people go to such lengths. Story 8. My cousin got glasses. Her 7-year-old little sister also wanted glasses because she thought it looked cool. So she began telling her teachers she couldn't read the chalkboard and started squinting at home, sitting extremely close to the television, claiming she couldn't see well. Her parents became concerned and took her to the doctor. During the vision test, she intentionally read everything wrong. Everyone became convinced she needed glasses, but the doctor had concerns. The test suggested she needed very thick lenses, which was unusual unless there was a strong family history of vision problems. Her parents both had perfect vision, and her sister only had mild astigmatism. That's when everyone began to realize she was faking. So the doctor told her parents, in front of her, that she would need an intensive eye surgery to be able to see without glasses. They even brought in a machine to make it look convincing and said they could do the surgery right away. She panicked, confessed she had been faking everything, and burst into tears. She ended up getting grounded. Story 9. I'm an audiologist, hearing specialist, and have worked both in the private sector on legal claims and with the VA handling veterans' hearing loss cases. In both settings, faking hearing loss is common. For me, the hearing test begins when I call the patient's name in the waiting room. If they respond to their name in a normal voice, I already know they have normal or mild hearing loss at most. That was the case with this man. He responded normally, came in, and we had a regular conversation. We began testing. I gave instructions over headphones at 50 decibels, a moderate volume. Raise your hand when you hear the tone. He didn't respond. I increased the volume and kept increasing. Eventually, I was playing a 100 decibel tone in his ear. He physically flinched from how loud it was, but still didn't raise his hand. Even after repeating the instructions, he refused to acknowledge any sound. I immediately knew he was faking. I've taught full courses on identifying and handling cases like this. I wrote a detailed report outlining the inconsistencies and clear evidence of malingering. What made this case memorable was that he had seemed so friendly before. He was a fire chief, and I have firefighters in my own family. It was one of those moments where you think, if we weren't in a professional setting, we could probably be friends. But he was determined to get a disability rating through deception, and that really frustrated me. Story 10. Fourth-year medical student, I was on my ER rotation when a trauma patient came in, a woman who had been arrested. During transport, she reportedly banged her head 4 times against the window of the police car and then went unresponsive. She arrived with a bruise on her forehead and was completely unresponsive. We were skeptical, but she was a convincing actor. Didn't even flinch during the digital rectal exam, which is standard for all patients in the trauma bay. Some nurses mentioned they saw her peeking when we left the room. We ordered a CT scan, which came back normal, and were even considering intubating her to secure her airway. Then our attending walked over, opened her eyelids, and held them open while firmly telling her to wake up. Eventually, she started resisting and tried to close her eyes. The act was over. The doctor called her out, and she immediately started screaming at us. Ironically, she had been far more pleasant when pretending to have a brain injury. Story 11. When I was a kid, I would plan my sick days way in advance. I had an old thermos where I'd pour leftover milk, meat, whatever. I'd leave it sealed on the windowsill in my bedroom and let it fester for a month. The thermos was closed, so no smells escaped. I'd set an alarm for the middle of the night, dump the contents onto my rug, and run to tell my dad I was throwing up and so sick. However, this thermos concoction filled the entire condo with a horrible stench. And both me and my dad ended up throwing up into the tub every time we tried to clean the rug. He had to take the day off work too. Needless to say, I never pulled that stunt again. Story 12. I'm an emergency medicine doctor. There are lots of fake seizure stories. Those are pretty common. Some of the people are seeking IV benzodiazepines, but most actually have seizure disorders with psychological complications. They're usually just confused, overwhelmed individuals who don't know how to deal with stress. But I've seen all kinds of people faking symptoms. The most deceptive one was a guy I'll call Steve. He had to be in the medical field, maybe a nurse or a tech. He was tall, skinny, and claimed to have Marfan syndrome, a rare connective tissue disorder that puts you at higher risk for aortic dissection. That's when the main artery from the heart starts tearing, a very serious condition. Steve didn't just say he had Marfan's. He claimed he'd had a dissection repaired by a well-known surgeon at a real institution, name removed. He'd come in with textbook symptoms, tearing chest pain radiating to the back. Then he'd flex his arm while the blood pressure cuff was on one side and relax the other, giving different readings in each arm. Another classic sign of dissection. On top of that, he'd claim an allergy to contrast dye, forcing us to pre-treat him with Benadryl and steroids, an 8-hour delay. During that time, he'd request pain meds and anti-nausea meds. For those unfamiliar, IV Dilaudid, Phenergan, and Benadryl taken together create a strong sedative combo, a notorious favorite among drug seekers. I got Steve on his 3rd visit. The previous 2 showed no dissection. He was foolish enough to return during business hours, and I called the surgeon he mentioned. Turns out he had never treated Steve and had received multiple calls about him. I still offered the CTA but told Steve he wouldn't be getting any opioids. He stormed out. No one's seen him since. I'm sure he's trying the same thing at a new hospital. Story 13. I'm a nurse and work in acute rehab, where patients recover from surgeries, illnesses, etc. We had a patient who fooled us all. He was medically stable and ready for discharge, but extremely anxious. Constantly asking me to recheck vitals and blood sugar, always claiming new symptoms like hand twitching, dizziness, or blurry vision. I thought I was doing well at ruling things out and calming him down. Then one day I found his pulse low, around 48. Everything else looked okay, so I told him I'd recheck soon. When I returned, he looked worse. Pulse still low, oxygen saturation also low, and he was slow to respond. I brought in the charge nurse, and we began to suspect an opioid overdose. His breathing got slower, shallower. We called the doctor and gave Narcan, called EMS. By the time they arrived, he was nearly unresponsive, barely reacting to a sternal rub. They gave more Narcan, no change. We started thinking stroke. His mouth had a slight droop. Was that always there? Did I miss it? We sent him to the hospital with a full report. The next day, we learned nothing was wrong with him. Turns out he likely overheard me mention his low pulse and decided to fake everything. Probably held his breath during the oxygen check and faked the facial droop. Might have skipped a meal to throw off his sugar, all because he didn't want to go home. He's now banned from our facility. Story 14. Late to the thread, but here's one from my psychiatry rotation during medical school. A patient was hospitalized for suicidation. She kept insisting she had a breast mass and demanded to be examined, but only by male doctors. When the psychiatrist I was rotating with declined, she asked me to examine her during our daily patient interview. I declined as well, but had a hunch and checked her medical records. She had undergone an ultrasound just a week earlier that showed only normal breast tissue. Apparently, she had visited multiple doctors with vague complaints, usually involving breast or vaginal issues, and only when she saw male physicians. We diagnosed her with factitious disorder, formerly called Munchausen syndrome, and histrionic personality disorder. Her goal seemed to be attention from medical professionals. She had complex psychological issues, but we also had to be cautious, as it was possible she was laying the groundwork for a lawsuit. This kind of case is exactly why doctors document everything thoroughly. She never admitted to fabricating her symptoms. According to the psychiatrist I worked with, she likely didn't actually believe she had a medical problem. She simply wanted the attention. If she truly believed she was ill, the diagnosis would have been illness anxiety disorder, hypochondria. But that wasn't the case here. Story 15. I'm not a doctor, but a nurse. There was a geriatric patient who constantly used the call bell because she was seeking attention. She always needed very basic tasks done for her and seemed to believe the facility was a hotel. In reality, it was a rehabilitation ward, where we tried to encourage patients to do as much for themselves as possible. She would ring the bell for things like, "Please lift the blanket for me," "Please pass me my phone," or "Please feed me," claiming her hands didn't work. However, I caught her several times lifting herself off the bed with her hands, grabbing her phone when it rang. You get the idea. After days of telling her no and encouraging her to be independent, she grew more and more frustrated. Eventually, she snapped, grabbed me by the collar, shook me aggressively, and yelled, "What don't you understand about the fact that my hands don't work?" I didn't know what to say. I just looked at her and blinked as she slowly released her grip. I guess I healed her hands. Story 16. Has anyone ever had a case where you thought, this person is probably just faking it for opiates, only for it to turn out to be a real case when the patient refused opiates? I overheard something like this while waiting to give a coworker a ride. A patient was complaining of severe lower back pain, and apparently his x-rays were clear. The nurse told him this, but he kept asking what other tests they could do and if there was anything that could help with the pain. He said none of the over-the-counter meds he tried were working. Red flag. The nurse told him bluntly that they don't prescribe oxycodone or similar medications without a clear diagnosis. But instead of getting upset, he calmly replied, "I understand why not. I wouldn't touch that stuff myself. Is there a surgery or something that can deaden the nerve? Or maybe zap it? It's killing me." That changed everything. They reviewed his case more thoroughly. Blood work came back, strongly suggesting kidney stones or cysts. Last I heard, they were preparing him for an ultrasound. The nurse's tone changed completely. You could hear it in her voice. She was so much more sympathetic as she helped him roll over for the scan compared to how she sounded earlier while telling him his x-rays were clear. Story 17. When I was at boot camp in the military, I'm in Europe, we had a 1-week survival drill outdoors during winter. This was in the Arctic, so we knew it was going to be rough. A buddy and I decided to report in sick with a fever and went to the infirmary. Young civilian nurses were doing the triage, and one by one, we were sent to a room with an old-school thermometer covered in a plastic sleeve and lube. We were told to insert it ourselves. Once the nurse left, we removed the thermometer from the sleeve, warmed it on a light bulb, and then shook it down to a reasonable fever temperature before putting the sleeve back on. It worked. We had a few great days in the sick bay, being pampered by nurses, joking around, and awkwardly flirting like 18-year-olds. Every morning the doctor made his rounds, so we repeated the thermometer trick and blew hot air into our pillows to warm up our foreheads so they appeared sweaty. Then Thursday morning came. The nurse entered, gave us the thermometer as usual, and said the doctor would be in shortly. But on her way out, she smiled and said, "And by the way, guys, if you still have a fever, you won't be released until Monday because the doctor's off tomorrow and we don't have doctors on weekends." Miraculously, we were fever-free and healthy again. We were dismissed just in time for the weekend leave. Looking back, we were young and just wanted a break from the cold and the monotony of training. I still send a warm thought to that nurse. She clearly knew we were faking it, but let us play our little game anyway. Story 18. Front desk person here. We had a young male patient who needed to provide a urine sample. He said he couldn't go, which is unusual for someone his age, but not impossible. I gave him some water and told him to take his time. He also had a bottle of iced tea that he was drinking very slowly. Whatever. Input equals output. After about 45 minutes, he finally went to give a sample. Great. Cups are in the washroom, wash your hands, and so on. He came back out with a sample that looked like completely normal, clear yellow urine. I took it to bundle with the requisition form and sent it off. It was cold. He had cheeked some of the iced tea, spat it into the sample container, and diluted it with cold water to resemble urine. Here's a healthcare tip from me to you. Freezing cold urine means only one thing, and it's never good. I don't remember what we were testing for. It wasn't drugs, probably just protein or glucose for a truck driving license. I doubt we dipped it just for fun, but if we had, I'm sure it would have shown a massive glucose reading, defeating the whole point of trying to fake it in the first place. Story 19. I was raised in the Cook Islands, a very Christian and traditional place. One of my friends, 25 million, used to come over to study. I was a rebellious kid, and one Saturday night, we drank an entire bottle of Bombay Sapphire at age 14. The next morning, his mom came by to pick him up for church. On Monday, he didn't show up at school. Then 3 days went by, a week, 2 weeks. After 2 weeks, I called him, and he told me the funniest story. On that Sunday morning at church, he had to throw up. He ran outside and vomited by a tree. His mom saw him, panicked, and rushed him to the hospital. Quick note, his family was the type to disown someone for premarital S, let alone drinking. At the hospital, he refused a blood test, fearing they'd discover the alcohol. The doctor diagnosed him based on symptoms and said it was the flu. He went home feeling sick for a full week, but eventually his parents became convinced it wasn't the flu. It had to be dengue fever, which was going around at the time. He refused treatment and kept pretending to be sick for 2 whole weeks. He eventually returned to school, and to this day, 11 years later, his family still believes he had dengue fever. In reality, he was hungover and probably had alcohol poisoning from our little Saturday night adventure. He still hasn't told his mom. Story 20. Anyone who's worked in an ER has seen cases of malingering, drug-seeking, pseudo-seizures, Munchausen syndrome, and Munchausen by proxy. 2 of the worst cases I've encountered involved one of each. The Munchausen by proxy case was a mother who brought in her toddlers, claiming they were vomiting blood. They were transferred to pediatrics even though they appeared fine. We knew the mother. She had a history of psychiatric instability. This one stuck with me because those poor children never had a real shot at a normal childhood. The second case was a woman with Munchausen syndrome. She had been hospitalized multiple times for septic shock and required pressors. She was missing some digits from previous Levofeed infusions. I'm intentionally vague to protect privacy. We finally uncovered the truth when, for the fifth time in 3 months, she suddenly became severely hypotensive, systolic pressure in the 50s, and slipped into unconsciousness about an hour into her ER evaluation. Intake vitals in her initial condition had seemed okay, so this was suspicious. We started a Narcan drip, and instantly her blood pressure normalized. Even though her drug screen came back clean, we figured she was dosing herself with street fentanyl after check-in. She tried this trick several more times, always resolved with Narcan. We eventually contacted other hospitals and learned she had done the same thing with them. We warned them going forward. Story 21. I'm not a doctor, but I was on the other side of this kind of situation. My doctor basically accused me of exaggerating or making up my condition. I told him I was experiencing severe sciatic pain, numbness, and weakness in my leg. He did some basic tests to check muscular responses and movement-based pain, then sent me for an x-ray, which made no sense since I knew it was likely nerve or muscular. He told me I was making it out to be worse than it really is, and that my mind was convincing my body it was in more pain. He said it would go away with time. After 3 months of return visits, failed physiotherapy, medications, and even chiropractic care, he finally, and very reluctantly, referred me to an orthopedic surgeon. He insisted I'd be wasting the surgeon's time. After 5 minutes of talking with the surgeon, he booked me for back surgery. Turned out I had a bulging disc that was pinching my sciatic nerve against a bony growth on one of my vertebrae. I don't go to that original doctor anymore. Story 22. I had a doctor turn me away as a drug seeker, but that wasn't exactly the case. I got dismissed by an urgent care doctor who said I was just someone wearing bad shoes. She pointed to the Tevas I was wearing, which I had on because I couldn't tolerate the pressure of putting my foot into a regular shoe, as evidence of this. All of this happened with my father sitting in the room. I couldn't recall any trauma to the foot, and while she acknowledged it was swollen, she said it wasn't swollen enough to be broken, which I agreed with, and that's what made it so confusing. She ordered x-rays, confirmed it wasn't broken, then yelled at me. I told her I wasn't even asking for medication. I just wanted to understand what was wrong. That only seemed to make her more agitated. Then she kicked me out. A few years later, still bothered by that same foot pain, I saw another doctor. They took new x-rays, and because the original urgent care clinic was in the same network, the radiologist compared the new image to the old one. I received a letter saying there was a redemonstration of degradation of the navicular cuneiform joint. Joint degradation, redemonstration. I was labeled a drug seeker at age 26 by a doctor who completely missed that I had arthritis. Story 23. My mom was a nurse in the emergency department. She had a man come in complaining of terrible pain in his testicles, and they had turned blue. He was crying in pain, and neither the nurses nor doctors could initially figure out what was going on. One doctor suspected testicular torsion, and the patient was prepped for emergency surgery. That was until one nurse noticed some blue dye on the inside of his leg and realized he was either using dye directly or had been going commando in new jeans and wetting them, which caused the color to transfer onto his skin. They ran additional checks and discovered he was an addict who had visited most local hospitals with bizarre, made-up conditions to get strong painkillers and attention. He had even undergone abdominal surgery at another hospital just weeks earlier for unexplained pain the surgeons couldn't identify. Story 24. A little girl was bouncing on her bed after dark. She had been told once to stop, but she kept going and eventually fell off, which alerted her parents. Rather than face their anger, she pretended to have a neck injury. Her parents, in a panic, called emergency services. It was clear she wasn't physically hurt, but her parents were so hysterical they hadn't noticed. The entire situation felt off, and even when we explained what unnecessary treatment and transport might involve, the little girl refused to break character. That's when I started thinking, if she's this terrified of what her parents will do once we leave, something deeper must be going on. She held her story firmly, and we transported her to the hospital for further evaluation. The story would later make the news. She had been a victim of abuse, and her parents were absolute monsters. Her determination not to trigger them was the very thing that revealed something was wrong. It's the most heartbreaking and important example of faking it I've ever seen. Story 25. This probably doesn't quite fit the usual pattern, but I still think it's a wild story. I have epilepsy, and after a seizure at home, I hit my head pretty badly. My sister was upstairs at the time. A few hours later, my head was really bothering me, and I had all the classic signs of a concussion, so my sister drove me to the ER. While we were there, a nurse was taking my vitals and asking about symptoms. That's when I had another seizure, according to my sister. While it was happening, she said the nurse was shouting for help, but no one came. After it ended, she ran into the hallway and found two other nurses walking by. She asked why they hadn't responded. Their answer? "We thought you were joking." Joking? In a hospital. Eventually, I was brought to a room and evaluated by a doctor. After everything he told me I didn't have a concussion, I had a cold, except I had no sore throat, no fever, no stuffy nose, no sneezing. What I did have was nausea, dizziness, confusion, double vision, blackouts, and a huge bump on my head. But apparently those are cold symptoms now. Story 26. When I was little, I had a lot of ear infections. So bad that I'd go temporarily deaf. When I was 4, I got the flu, a double ear infection, and chickenpox all at the same time. Needless to say, I saw my doctor a lot. He was really kind. And since my dad wasn't really in the picture, he sort of became a surrogate father figure to me. Apparently, a few weeks after I recovered from that awful combo of illnesses, I told my mom that my ears hurt and pretended not to hear well. Fearing another round of infections, she took me to the doctor. When he came in, I jumped into his lap and sang him the song of the wide-mouthed frog, complete with hand motions and a wide mouth, just like I had learned at preschool. He and my mom left the room to discuss my ears. When she came back, we went home, and I had no idea they had figured out I was faking. A few weeks later, I did it again and was rushed to the doctor. But this time, it was a new doctor, and she wasn't nearly as fun. I was devastated. Story 27. I'm a physical therapist. Early in my career, I was seeing a workers' compensation patient for a low back injury. She came into my office bent over, practically crawling, crying and yelling in pain. She told me she couldn't walk or stand up straight since her injury. I tried my best to conduct an evaluation, but every time I attempted a test to pinpoint the issue, she'd scream and cry. I couldn't even lightly touch her skin without her reacting dramatically. I offered to call an ambulance several times because she appeared so distressed, but she refused. She eventually left, and I turned to my computer to document the visit. That's when my coworker, who had witnessed the whole thing, said, "Wait, you're about to miss the best part of the show." I looked out the window into the parking lot and saw her walking completely upright, strutting across the lot, slinging her purse over her shoulder with one hand and chatting on her phone with the other. She got into her car and drove away like nothing was wrong. I've never seen a faster recovery. It was a miracle. Story 28. Not a doctor, but I've been on the receiving end of professionals thinking I was faking it. I suffer from migraines that mimic stroke symptoms, full facial droop, left side paralysis, confusion, and a speech impediment where I forget words and speak slowly. Normally, I catch the signs during the aura phase. But if I don't, I just have to wait it out for a few hours and then deal with a few days of weakness and instability. This particular episode happened at university. I was surrounded by people who didn't know how to help, despite my support worker having informed them about my condition and care plan. Someone called paramedics, which was the right call, given the symptoms. When they arrived, I was drowsy and displaying all the typical signs. But instead of believing me, they assumed I was faking it. After trying to rouse me and growing frustrated, they performed a sternal rub, which is incredibly painful. I was just starting to return to baseline, and that action both hurt and terrified me. They made me go to the hospital and didn't allow anyone to accompany me. Once there, I was triaged as urgent and spent some time in the stroke ward. Turns out I wasn't faking it. My tests and symptoms pointed to a neurological issue. I was discharged the next day after my symptoms faded and a neurologist assessed me. Diagnosis: hemiplegic migraine. I'm now afraid of going through this again and not being believed. Honestly, if they had just followed my support worker's guidance, the trauma could have been avoided. Story 29. I've been a nurse for many years. My sister had an illness that caused terrible pain, joint swelling, abdominal bloating, and severe weakness. It got so bad we had to buy her a walker just to help her stand. But no one would believe her. She saw dozens of doctors who claimed she was malingering or seeking attention and referred her to psychiatrists. I personally witnessed her gain 10 pounds over just a few hours and watched her stomach swell several inches in a single afternoon. I was stunned by how many doctors dismissed her as a hysterical female just because her diagnosis wasn't straightforward. Eventually, she got a referral to the Menninger Clinic, but even there, we had to fight to switch doctors after the one assigned to her accused her of faking it. A few simple tests later, we got the answer. She was truly sick. Her body was literally starving itself. The diagnosis came from a basic autoimmune panel that none of the previous doctors had thought to order. She survived and is doing okay now on medication. It's easy to laugh at some of these stories, but not all illnesses are visible. Too many patients, especially women, are dismissed or ignored when they're genuinely suffering. I try to keep that in mind when I see a patient who's been labeled a faker. Sometimes they just haven't found the right person to listen yet. Story 30. Not a doctor, but I was at Children's Hospital in Seattle in the early 90s for a major surgery due to a birth defect. I was sharing a room with a girl who, one morning, suddenly couldn't use her legs. She collapsed and was rushed to the hospital. I think she was between 8 to 11 years old. I was 6, so my memory's a little fuzzy. They spent so much time doing physical therapy with her, and she would cry and scream like it was unbearably painful. I used to cry with her because my physical therapy was also painful, and I understood. She became really good at using her arms, but all the tests still showed nothing wrong. The doctors were stumped. One day we were all outside for lunch, and a volunteer, a candy striper type, was watching us. She stepped inside briefly. We were in an enclosed, safe courtyard. And during that moment, Ms. Can't Use Her Legs did a cartwheel, then a back bend. Her legs fully supported her weight. I didn't notice it at 6, but an older girl did and told the nurse. They checked the courtyard tapes and she was completely busted. She stood up and started crying, admitting she didn't know how to stop lying once it got out of hand. It was wild. Story 31. I'm a psychiatrist and work with criminal justice patients. I have so many stories. One man faked Parkinson's disease to avoid jail. At that facility, if you couldn't feed, clothe, or toilet yourself, you were placed in the public hospital until you recovered or served your sentence. He had a legitimate history of Parkinson's, and while they waited to get his meds, his tremor returned and he couldn't feed himself. So he was sent to the hospital and became my patient. We restarted his meds, but he still claimed he couldn't feed himself. However, if you left food on the tray and closed the curtain, the food would mysteriously disappear. Another patient faked having cancer for over a year. He ended up in our ER, and I was consulted. He had 2 liters of urine in his bladder, which is way too much. He claimed he had stage 4 melanoma, but the hospital where he said he was receiving treatment had no record of him. His dad and girlfriend were in the room when we confronted him, and his poor father was so embarrassed. This man had convinced his girlfriend to shave his head. They went on a big trip together. He would text her fake updates from the doctor's office while she was at work. His parents gave him rides to appointments, but never went in with him. Since he was in his 30s and said he wanted privacy, they didn't think it was weird. My attending looked him in the eye and said, "You really are something else." We signed off before figuring out what was causing the urinary retention. I hope that poor woman left him. Story 32. Not a doctor, but I was once taken to the ER for severe abdominal pain. I brought a stuffed animal to bite and scream into, so I wouldn't bother anyone. My dad, who's a retired EMT, noticed a woman nearby who seemed to be exaggerating or faking. After I calmed down enough to speak, he told me about her. She was loudly complaining about stomach pain and yelling about how long she'd been waiting, saying she was violently throwing up. She had a baggie with her, but she'd only dry heave and maybe spit into it occasionally. The only times she stopped were when she talked to her friend or boyfriend. Eventually, she got called back, probably for vitals. And suddenly she stopped throwing up and speed walked over. She came back a little later looking annoyed, sat down and resumed using the baggie like nothing happened. I feel bad for ER staff who deal with people like that. They're the ultimate type of entitled person, because in this setting, people are more likely to take their side. It also makes it harder for patients like me who are really in pain and end up being treated with suspicion because of people like her. Story 33. Minor car accident. The woman and her passenger said they were fine, clearly annoyed but polite. The man who hit them seemed lower middle class but well kept, driving a meticulously cleaned older sedan. About 15 minutes later, after whispering back and forth, the woman walked up and firmly demanded that the fire department respond. Important details. We were literally 50 steps away from a hospital, right near the ER entrance. Everyone had initially declined medical attention. She had even said she barely felt the impact. But now she claimed she couldn't walk while standing in front of me and insisted she had to be taken to the hospital. I pointed to the hospital but called fire anyway. I had a good relationship with the firefighters and had trained them to recognize the code for a suspicious call. I discreetly relayed that I believed it was fraud and told dispatch, who also knew the code, not to run sirens. Not worth risking a fatal crash for a faker. If it had been serious, I had a kit with me, or would have carried her across myself. As soon as fire arrived, I heard her say to her friend, "I don't care, he's going to pay for it." The poor guy was stressed. I reassured him not to worry. I wrote a lengthy report documenting her post-crash behavior, and she received a ticket for cutting him off. He got one too for following too closely. But no one realized there were cameras everywhere, red lights in stores nearby, and I was feeling petty, so I gathered all the footage. The judge ruled no fault. Pretty sure she had to pay her own medical bills. Story 38. A couple of years ago, I tweaked my neck while helping to take a refrigerator to the dump. A few days later, the pain got so bad I could barely move my head. The only shirt I could manage to put on was an old oversized one. I drove myself to urgent care. I didn't realize this until afterward, but I probably looked like some kind of addict. I had bedhead, a giant shirt on, was holding my head at a weird angle, and constantly rubbing my neck. The receptionist kept asking me how I hurt my neck, like she expected my story to change. When I saw the doctor, she asked all the same questions, but with a strange expression, which I now recognize as the "I don't believe a word you're saying" look. She told me to lay down, and I said I couldn't because my neck hurt too badly. That was the test. After helping me lie down, she lifted my head in her hands and told me to relax. When I finally relaxed my neck muscles, she let go and dropped my head. I instinctively tensed to keep from smashing my head on the table, and pain shot through my neck and back. I screamed, loudly. She looked very satisfied with herself and treated me like a normal patient afterward. I was so confused. I didn't realize they were testing me until I talked with my girlfriend, who was in medical school. She thought it was funny and said that if I had shown up to her looking like that, she might not have believed me either. Story 39. I'm a nurse. One day a patient was having seizures. A very experienced EMT and I both believed they were real and gave her Ativan, which worked. I called the doctor and told him what we did and asked him to check on the patient. This was a rural emergency department where I worked PRN. The doctor walked in, spent about 20 seconds with the patient, and came out saying she was faking it. I was frustrated. He hadn't even seen the seizure. How could he possibly know? Shortly afterward, her family arrived, and she was being discharged. They were very concerned, and honestly, so was I. One of them asked what would happen if she had another seizure. She responded, "Trust me, I'll never have another one again." That was the moment it all clicked. The doctor had figured it out from the way she asked questions. She was seeking attention. He called her out on it, and she admitted it. Then he warned that if she faked another seizure, he would make sure her driver's license was revoked for having seizures. After that, he taught me other ways to spot fake seizures, including popping a pneumonia stick in my face. He passed away last year from cancer. He was one of the best doctors I've ever worked with. Story 40. When I was in the military, I had really bad migraines. The doctor sent me for a vision test. One of those machines where you rest your forehead against a support, but the tech hadn't set it up properly. I saw two overlapping sets of letters. I told her this, and she just asked me to tell her what I saw. So I kept listing the letters. This letter and this letter. The doctor got really upset. She said there was no way my vision was that bad, or I wouldn't have been able to walk from the dental clinic to the med clinic. She threatened to send me to the hospital for a spinal tap. a painful and risky procedure, unless I admitted I was exaggerating. She even said she'd call an ambulance unless I confessed. I told her again to speak with the tech. Eventually, I repeated the test. I told the tech the same thing, and she finally looked at the machine and realized I was right. She fixed the issue and I completed the test just fine. But the tech didn't admit her mistake to the doctor, so the doctor still believed I was lying. I tried to switch doctors afterward, but she kept reassigning me back to her. She even wrote in my medical record that I was a malingerer and could be financially burdensome to the military. Later on, I began having pain in my left shoulder. A year after shoulder surgery, she referred me to mental health, saying the pain was in my head. It wasn't until my arm literally popped out of the socket and turned purple that my commander personally took me to the clinic. Turns out the original surgery hadn't been done correctly. My labrum was retorn, my rotator cuff was damaged, and the joint capsule had doubled in size due to continued use. By the time I was finally examined, it had been 6 months since I first reported symptoms. I had even been serving as a physical training leader. That doctor would probably tell my story in a thread like this, truly believing I was faking the whole time. Story 41. Not a doctor, not a nurse, just a patient. I was 22 or 23 years old, living just outside of Detroit, and started experiencing the most terrible random abdominal pain ever. It was between my belly button and pelvis, stretching from the belly button to my left hip. It wasn't constant, but it was sharp and intense. I couldn't make any sense of it. I would end up crying from the pain and even ask my boyfriend to sit on my stomach because the pressure helped. I ended up in the ER 3 times a week, every week, for almost 2 months. Each time they told me it was just gas or constipation, no blood work, no scans, nothing. I never once asked for pain meds, but they assumed that's why I was there. About 7 weeks after the pain began, I was rushed to the ER by ambulance, and then straight into emergency surgery for an ectopic pregnancy that had ruptured my left fallopian tube. I was bleeding internally. The doctor said if my mom had waited even another 20 minutes to call for help, I would have died. Story 42. I'm a prosthetist, Josh orthotist. We make all kinds of braces for people with neurologic or orthopedic conditions. I even do house calls for patients with transportation issues, which is common. One day I was sent to a woman's house by her doctor to evaluate her for AFOS, ankle foot orthosis. I knocked at the front door and waited. No answer. So I went to the side door under the carport. As I passed a large kitchen window, I saw a woman walking through the kitchen. When I knocked on the side door, that same woman answered, now in a wheelchair. I introduced myself and asked why she needed AFOs. She told me she was paralyzed and had no control of her feet. Once inside, I noticed she was propelling herself around the house in her wheelchair by using her feet, the same feet she claimed had no function. I conducted a manual muscle test. She presented as 0 out of 5 in all muscle groups, which is very easy to fake. All you have to do is claim you can't move, and it's impossible to prove otherwise. She also claimed she couldn't feel me touching her, but I saw her flinch multiple times. I told her I would speak with her doctor before deciding whether she needed the braces. She was adamant she needed them. I followed up with her doctor, who believed she hadn't walked in years and was in need of the devices. So basically, I watched a woman who claimed to be paralyzed walk through her kitchen and hop into a wheelchair, which she used with her fully functional legs, all to get fitted for braces she didn't need, and that she would have to pay for. Story 43. During my residency, I had a patient with mandible and midface fractures that were successfully treated. He stayed the expected amount of time in recovery, and on the day of his anticipated discharge, he refused to leave. When we asked why, he told us his apartment didn't have air conditioning, and he liked the cool air in the hospital. We had taken a piece of his iliac crest to reconstruct part of his jaw. He was walking just fine, but once we told him he had to go, he suddenly claimed his hip hurt and that he couldn't walk. The social workers informed us that we couldn't forcibly discharge him. 2 weeks went by, and we realized he was trying to stay through the heat of August. That's when we got a peripheral vascular surgeon involved. The next morning during rounds, the vascular surgeon walked in with us, said nothing, and started marking dotted lines above the patient's knee with a purple surgical pen. We began discussing an amputation due to venous stasis and said that, since he couldn't walk, surgery was booked for the next morning. We reminded him not to eat after midnight. During evening rounds, we discovered he had self-discharged and walked out on his own. Miraculously, he could walk again. Praise the Lord. Story 44. I had an 18-year-old female patient with a complicated medical history. She had over 30 drug allergies listed in her chart. She and her mother insisted it was due to a rare genetic immune disorder called mast cell degranulation syndrome, MCDS. Because of this, they made numerous special requests that they imposed on the hospital staff. No foam hand sanitizer, no latex gloves, and even extreme demands like no glitter allowed in the room. We went to great lengths to accommodate them, and her minor skin infection, the reason she was admitted, looked fine. Things became more interesting when I reviewed her chart and found a visit from a pediatric immunologist about 5 years earlier. Turns out she had undergone extensive testing for MCDS, all of which came back completely negative. She was formally diagnosed with a much less severe condition called chronic urticaria, which is basically extremely sensitive skin. That same specialist clearly documented the diagnosis and explicitly warned against using dangerous interventions like epinephrine. In other words, none of her so-called allergies were true or life-threatening. It was clear they didn't accept the diagnosis and had latched on to the much scarier MCDS despite the evidence. I believe this was rooted in an underlying psychological condition called Munchausen syndrome, where a person forms an intense emotional attachment to the role of being sick. She continued to demand more specialist referrals, as is common in such cases. She now sees a hematologist who believes her self-reported diagnosis and prescribes her epinephrine autoinjectors, which she reportedly uses multiple times per week. The most tragic part is that if she continues this self-inflicted medical abuse, she may not live a normal lifespan. Misusing epinephrine can lead to strokes, aneurysms, and severe vascular complications, even in otherwise young and healthy patients. Story 45. I'm a patient, and I've made amends with the doctors I once put through personal hell. For about 14 years, I tried to end my life. Car accidents, self-inflicted wounds with knives, blunt objects, overdoses. You name it, I tried it. But one of the most painful parts was during a time when I was in an abusive relationship. My ex-fiancé used me as a punching bag. Then he'd flip the script, say he felt bad, and bring me to ER after ER. Not for my safety, but to help himself get more pain medications, alongside the ones he was already giving me from his own prescriptions. I had to lie, say I had fallen, passed out, or gotten drunk, anything to explain away the marks he left. After a while, one doctor finally saw through it. He asked my fiancé to step out, saying he needed to do a private test. Then he looked me in the eyes and said he'd been watching me come in for years and knew this wasn't just about mental health. He saw something more. I was so emotionally destroyed at the time, I told him to leave it alone and lied, saying it was all my fault. Thankfully, I've come a long way since then, but I'm posting this to say, before you laugh at people like me, who might seem like drug seekers or who appear to be faking, know that there are often heartbreaking stories behind the scenes. Even after I escaped that man, which only happened because he went to prison, things got worse. When he got out, he kidnapped, drugged, and assaulted me. I didn't go to the hospital. I didn't think anyone would believe me. My mom and ex-boyfriend took photos for the police, but because I couldn't name who gave him the drugs, they dropped the case and said I might even face charges for false reporting. I won't go into the rest of the story because it gets even darker, but please understand, we're not always funny stories to be laughed at. Sometimes we're not funny at all. Story 46. We had a patient come in with what he claimed was severe respiratory distress. He was hyperventilating and coughing nonstop. We got him hooked up to monitors, but he was breathing so fast and erratically that we couldn't get a clean waveform of his respirations. Because of this, his pulse oximeter showed low readings, mid-80s. As part of the emergency process, we attempted to get an IV line, but his veins were completely shot, so we moved to place an IO, intraosseous line, which involves drilling into the shin to access the bloodstream when veins aren't an option. The moment he heard the word IO, this man, who was supposedly in full-blown respiratory distress, suddenly became alert enough to refuse the procedure, and even helpfully pointed out a usable vein on his leg. While doing that, he forgot to hyperventilate, and for a few seconds, a clean waveform popped up showing his O2 saturation at 98%. The doctor caught this, But because the presentation was still concerning, they decided to proceed cautiously. Throughout this ordeal, he was texting someone on his phone, while supposedly struggling to breathe. Eventually, the decision was made to intubate him, inserting a tube to aid with breathing. The doctor still had doubts, but felt it was safer to act in case the condition was real. As soon as we intubated him, he stabilized instantly. Later, we called his family. Their response? Let us guess. Then they described the entire situation in perfect detail. The hyperventilating, low-pulse ox, refusal of IO, and the eventual intubation. Turns out, this man hops from ER to ER pretending to have respiratory distress because he likes being intubated. Apparently, he also craves the attention. I don't even want to imagine the full reasoning behind this. But hey, props for the commitment to the role, I guess. Story 47. I'm a paramedic in Germany. Here, ambulance services are free, so naturally, some patients call us for absurd reasons. One woman in particular calls us around 3 times a week, sometimes up to 10 times. Other weeks, not at all. Most of the time, she's faking it. Seizures are her go-to. She also has some mental health challenges, so her performances aren't always convincing. One time, we arrived to find her lying on the ground pretending to seize. So we just stood there, doing nothing, waiting for her to stop. Suddenly, mid-seizure, she looked at us and said, "What are you doing? I'm having a seizure right now." At that point, I completely lost it. We stood there for 5 more minutes until she finally gave up. Another time, she pulled the same stunt, but a doctor came along with us, one who didn't know her history. She did a convincing job, and he didn't believe us when we said she was faking. He tried to place an IV, but her veins were in terrible condition, and she was clenching her arms tightly. So he decided to go with an IO instead. Ever since that day, you can stop one of her fake seizures instantly by loudly saying, "I'm going to get the drill." Like magic, the seizure ends right there. Story 48. I'm not a doctor, but I've never had the opportunity to share this story before. So here we go. I went to school with a girl who was a bit odd. She told small white lies now and then. Nothing that hurt anyone, but it was annoying since they were obviously untrue. One day in class, she started sneezing. I put that in quotes because she kept her eyes open, and it was clear they weren't real sneezes. Anyway, she started and just didn't stop. It got so bad she was sent home. This continued for about a week. Eventually, she returned to school, but by then she was being referred for a CT scan because people suspected it was some kind of brain disorder. For a few weeks, everyone was amazed. We were young and genuinely thought she might have a strange illness. But after about a month, it got annoying sitting in class listening to constant fake sneezing, and people lost interest. And just like that, miraculously, the sneezing stopped. Story 49. I work in the ER. Before I get into my story, I have to say that patients fake things all the time. Sometimes intentionally, sometimes without even realizing it. It's usually pretty obvious. They don't seem to realize we see hundreds of real cases and can spot the fakes quickly. This brings me to the guy who came in claiming to have tetanus. Spoiler, he was faking, but he fooled everyone. Tetanus, or lockjaw, causes severe muscle spasms and can even shut down your breathing. It's extremely rare now thanks to vaccines. This guy had a flawless story. His tetanus shot was overdue, and he said he'd stepped on a dirty nail recently. He even had a wound. His symptoms matched the textbook perfectly. Extreme pain, muscle spasms, and difficulty breathing. He looked miserable. He almost got intubated in the ER out of fear his respiratory system might shut down. He received high doses of pain meds and benzodiazepines and was admitted to the ICU for treatment. He had the entire staff convinced. Around day 3 or 4, his wife showed up and casually said, "Oh, he's doing this again?" She explained he had done this before and didn't actually have tetanus. He got up and walked out of the hospital. Turns out he was trying to become an actor and used ER visits to practice by pretending to have rare medical conditions. He had an entire acting website dedicated to it. It was ridiculous, but honestly, one of the most convincing performances I've ever seen. In hindsight, he clearly studied the symptoms in detail and nailed the presentation.